Welcome to today's lunch lecture, Corona and Climate, virtually streamed from the campus of Erasmus University Rotterdam. My name is Willem Scholte. I work for Studium Generale, the department of the university that organizes lectures, talk shows, and cultural events. Please let me shortly guide you to today's digital lunch lecture. First of all, I'm very happy Yogi Hale Hendlin will give a lecture of around 30 minutes. And during and after the lecture, it is possible for you to ask questions with the webinar Q&A button you find below on the screen when you move your cursor or mousepad. After the lecture, two of the committee members of the Capita Selecta, our partners in these lectures, prepared some great questions that Yogi Hendlin will elaborate on. And of course, he will also answer some of the other questions from the chat. But before it is time for our guest speaker of today, I would like to give the digital floor to Professor of Anatomy at the Erasmus Medical Center, Geert-Jan Clarensink, with which we've set up this series. Professor, the floor is yours.
Start my video. Yeah, here I am. So there was some delay in the technical aspects. So welcome, people, for the second lunch lecture of the mini-series Crisis, What Crisis? As you know, probably the title is from the Supertramp album Crisis, What Crisis? And we thought it was a good title for this two lectures on the crisis, on crisis in general. This, of course, also organized by two groups. That's the Medical Faculty Association of the Students of the Medical Faculty Rotterdam, MFVR, and of course by Studium Generale, of which you heard already, Willem Scholte and Lenia Slierenbrecht, the other two. After last week, Mark Schuilenberg talked about hysteria during crisis or caused by crisis. Now, I'm very happy that we have a completely different viewpoint on crises. And that is the relationship between the climate crisis and this corona crisis. We don't know exactly what the relation is, but we're very happy that we have an excellent, an eminent speaker on climate and climate change for this meeting, which is, of course, Yogi Hale Hendlin. Welcome to you, Yogi. And I'd like to introduce you shortly. So what we thought is that in this lecture, we need a philosopher. We need a philosopher. We already thought last time there was a historian, and he was also talking about this crisis. But now we thought, okay, now we need a philosopher, and he's not a simple philosopher or simple philosopher. He is an environmental philosopher, which is of course a specialization of philosophy, and we're very happy. He works as an assistant professor at the Erasmus University, but that's not the only thing. He's also a research associate, I have to read that, from the Environmental Health Initiative at the University of California. And he has, of course, a magnificent scientific curriculum, resume, in which he published a lot of articles on this subject. For instance, the British Medical Journal, which is a well-renowned medical journal, plus Medicine, he has already published in the Annals of Internal Medicine, also very high-level, high-impact medical journals. So I think we have the best of both worlds here. We have a philosopher who's also well-known in the medical field, and this is actually what we do in these lectures. We look for medical subjects, but we are also looking for the border of medicine and other sciences. So we are, of course, now very, very happy that I can introduce to you Yogi Hale Hendlin, and I would say, okay, Yogi, the floor is yours, and we are very anxious to know your standpoints on the relation between Corona crisis and the climate crisis. Thank you very much.
Thank you. Thank you very much, Professor Kleinensink, and thank you, Willem, for having me, and the students of Erasmus Medical Center, and also, Studium Generale. So I will share my screen now of the presentation, and hopefully this will work. Yeah. Everybody can see, yes? Okay. Yes, so thank you so much for having me. I think that this is a wonderful initiative, especially in these times when we really have so many questions, way more questions than answers, and that we're looking to find meaning so that we can find a rational way to move forward in an irrational time when we're being inundated with fake news, when we're being seen some fundamental breakages in our democratic order and solidarity, and our notion of what qualifies as truth, as well as just the uncertainty of not knowing, how the next wave will be, and if a vaccine will be able to get this virus under control, and how we can build back better, as they say. So first of all, I have no conflicts of interest to declare. And I wanted just to put this image up first. It's been called the most representative image of 2020. This is in California, where I'm originally from. And of course, this just shows, the tragedies piled upon tragedies, which we are experiencing right now as a species, and as as an Earth, as a planet. And we see that, a senior center that was doing its best to try to keep, a very vulnerable population safe, actually got burnt down by a California wildfire, right? Which leads us, to, I think, really dwell on some questions at length. Currently, there's no vaccination for the Earth. We try with the Kyoto protocols, Paris agreements, but I want today to have us start thinking more about the notion of prevention and inquiring a little bit deeper into what prevention could mean. Right, my background's in environmental philosophy and public health. And in public health, we talk about prevention a lot, but generally we have our toolbox, right, as epidemiologists or other medical specialists. And as Nietzsche said, when all you have is a hammer, everything looks like a nail. So I'm saying, let's share our toolboxes. Let's look outside our toolbox to see what other tools we might be able to find. So we know that, for example, according to the WHO, that the direct health impacts of global warming increase all sorts of problems, including respiratory diseases and vector-borne illness. So I'm just going to go through some statistics briefly before we move on to the central topic. So the top 10 causes of death in high-income countries, 9 out of the 10 are non-communicable diseases or chronic diseases. And in the last century, we can really see that we've had a move from mortality due to infectious disease to mortality due to chronic disease. And if we want to talk about annual deaths, there's about 56 million annual deaths per year, about 150,000 a day. And communicable diseases are but a small part of that. Even malaria, which affects, is a horrible disease, especially because 67% of those who die from malaria are children, is in terms of absolute numbers, very Yeah, far less than smoking or air pollution or obesity or sodium or alcohol as risk factors for death. And so these are what the non-communicable diseases, especially these risk factors, are what we could call industrial diseases, diseases that were created as a byproduct of industrial culture, 100% preventable, and yet what we've done to address them has not so far been enough, right? So according, as of yesterday, this year, 1,335,000 humans have died from COVID-19. And just to put this in perspective, with the 56 million deaths per year, of course, as someone working in public health, I want to say as a disclaimer to begin with that, of course, these deaths are a tragedy. Of course, that they count in terms of even with the comorbidities that we know that that these should be reduced and prevented by all means, and that we should use all the measures that we know to reduce them. And I'm also going to make the case in this presentation that there are comorbidities leading to COVID-19 morbidity and mortality that are 100% avoidable, that we need to start focusing on. And I also will touch on briefly this 800,000 suicides per year globally, as we see some disturbing trends in mental health outcomes related to the measures and regulations taken to combat the COVID-19 virus. So if we look at the number of deaths by risk factor, almost all of these are preventable, right? These are lifestyle factors, and many of them are due to inequalities and pollution as well. Here's another way to visualize it in terms of percent. We see cardiovascular disease, cancers. The number of deaths so far this year are about equal to the number of deaths by road accidents. That's, driving too fast, things like that. And that when we talk about total health or planetary health, how do we put these into perspective? How do we address problems like, say, food advertising or smoking, which is nobody needs to smoke to be alive. Nobody needs to overeat to be alive. It doesn't really help anybody have better health or stay alive. And so why have we as a culture globally, not just Dutch culture, not just European culture or Western culture, but why have we not addressed any of these other issues? When, if we care about the number of death, if we care about suffering, if we care about the severity, why are we complacent with these issues, with these other types of death? And why is all of a sudden, many extreme measures, including shutting down our economy, occurring for an infectious disease? Why is infectious disease in our primate mind so much worse than in chronic disease? And to answer this, I'll talk a little bit about terror management theory and how our instincts are for the immediate, for the sensational, and the role of our culture in having a sort of disproportionate attention on certain issues rather than others. So in terms of vectors of disease, a recent study from the Cornell Alliance for Science at Cornell University found in looking at all the media in the US that their biggest surprise was that instead of conspiracy theorists, that it was actually the President of the United States was the single largest driver of misinformation around COVID. And the New York Times article author was not surprised. And it's very interesting that this is then being promulgated by our establishment media services. That there's, before you sort of had the media and then social media was spreading that. Now you have sort of from the bottom up social media creating hype about something, and the media picks up that. So we have sort of a reversal in our current times of the arrow of media causation, you could say. But you see, this is from April, and the president of the United States at the time, was making the media responsible as well. So you sort of get this Ouroboros effect. But I want to talk about more particularly how environmental factors like air pollution, which are 100% avoidable and preventable, these and also the other diseases that come from air pollution, actually make the SARS-CoV-2 virus spread, both in terms of infection and outcomes, worse. So we know that air pollution provides transport for the virus, sometimes over long distances, many, many kilometers. And we know that industrial air pollution provides this carrier, right? I have just up here a couple of the journal articles that I've been looking at, and from Frontera et al. 2020, they write, fine particulate matter with an aerodynamic diameter of 2.5 millimeters or less, called PM 2.5, or 10 millimeters or less, PM 10, sulfur dioxide, nitrogen dioxide, carbon monoxide, and ozone, which are all the off gassing of industrial activity, including combustion engines. That these affect our airways through inhalation and exacerbate the susceptibility to and severity of respiratory virus infections, right? So too much we've been seen as this virus out there, and that, if you're in a crowded room, which we should avoid being in an inside place with people, that, in a large crowd. If you're going to be in an indoor space with people, make sure it's ventilated. If you're going to be in an indoor space with people that you don't know, wear a mask. But how often do we hear, oh, reduce air pollution? And those are all good things, but we're not focusing on the elephant in the room, and that's what we should be focusing on, I will claim. So we know from previous studies for the influenza virus that air pollution levels directly influence transmission, right? And that PM 2.5 stays in the air longer, and their small size gets deeper into the lungs, right? According to the American Lung Association, increased pollution increases susceptibility to infection. All things being equal, a person exposed to air pollution would likely have a worse outcome if they were exposed to coronavirus. So let me say that again. All things being equal, a person exposed to air pollution would likely have a worse outcome if they were exposed to coronavirus. So we're talking about rates of infection as well as outcomes here. And this is something that should be, I would say, number one in public health, because it has so many knock-on effects. If we take care of air pollution, we can take care of so many other diseases and have so many fewer hospital admissions, so many fewer chronic diseases, and so many fewer COVID infections and deaths. And we see, with RIVM, that 80% of those people admitted to the intensive care units have pre-existing chronic disease, and 90% of those who die from COVID-19 in the Netherlands have comorbidities, pre-existing chronic diseases, many of which come from our polluted air. In Rotterdam, we have some of the most polluted air in all of Europe. And so this is a factor that we should be paying attention to. So an increase of only 1 gram per cubic meter in PM 2.5 is associated with a 15% increase in SARS-CoV-2 death rates. And another paper found that if Manhattan, New York, had lowered its average particulate matter by just a single unit, or 1 microgram per cubic meter over the past 20 years, the borough would most likely have seen 248 fewer deaths from SARS-CoV-2. And this, this research could have significant influence for how public health officials choose to allocate resources as the pandemic spreads, looking at high pollution areas as especially likely to get hard hit. For example, the 5 most polluted regions among 66 analyzed in Italy, Spain, France, and Germany accounted for 78% of all COVID-19 deaths. And so I really don't know why this isn't on our radar yet. And I don't know why, but I have some hypotheses that we can entertain. And part of this is because it's really, really difficult to change politics and economics when you have special interests that basically have a tremendous unequal amount of control, right? Of government, of resources, of media. And that it's really hard, shouldn't be, we're undergoing the most unusual sort of quarantine in the last 100 years since the Spanish flu, which was actually an American flu, but Spanish was the only neutral country in the time, so they called it the Spanish flu. And we're doing all of this, but so obviously there's ability and capacity, but we're not holding accountable the polluters of our air. We're not saying we have to switch over to a zero one-use plastic society, a circular economy, a no fossil fuel economy. Those calls, are fewer than they need to be. And even with personal protective equipment, right? What we're doing is we're displacing harms from one place to another, right? All of these protective masks, equipment, measures are made somewhere, and they're made from stuff. And that stuff comes from somewhere, it's mined from somewhere. And there's a tremendous amount of pollution that happens in creating this stuff. And most of it, like PPE, is made from oil. So there's no byproduct-free medical device. They all have environmental health externalities. So what can we do to decrease their ecological footprint? Well, many medical institutions and public health officials say we should get rid of disposable masks for all but healthcare workers. So if you're dealing directly with somebody who you know is sick or could be sick, then having a disposable mask makes a lot of sense, even though using ultraviolet radiation to cleanse non-disposable masks works very well. But we do know that 50 million masks are produced daily and most are discarded. And these contain microplastics and pose environmental hazards. And unfortunately, it's creating another plastic pollution problem. Well, whereas cigarette butts previously were the #1 piece of trash found in places, PPE is surpassing that currently. And PPE cannot be recycled due to contamination, and many of these items contain forever chemicals such as PFAS, perfluorinated alkylated substances. So there are better ways of meeting our needs. For example, at UCSF, where I'm affiliated, they have taken their Maker Lab to continuously print reusable 3D face shields to reduce waste. And we need to think about self-defeating protection measures, right? So for example, the hotter the planet gets, the more air conditioning we use, but to make more air conditioning, we make the planet hotter, right? That's a sort of self-defeating you can't, it's by definition unsustainable. We can't do that forever. And the same thing with PPE, right? The more we use and need, the dirtier we're going to make our air, right, to make these things, and the more vulnerable it will be to airborne diseases. So I like to take an environmental determinants of health perspective based off the WHO's definition of environmental health as addressing the physical, chemical, and biological factors external to a person and all the related factors impacting behaviors. So this is for preventing disease and creating health supportive environments. So how can we create health supportive ecologies, right, in our built environment? So I think we need to redefine prevention and population health. Even contact tracing and social distancing are not truly preventative measures. They're triaging measures for an emergency that has already occurred, right? I'm a member of the Dynamics of Inclusive Prosperity initiative at Erasmus University Rotterdam, and our scientific director, Martin de Jong, published in March. He called up Schiphol and he asked them, what preventative measures are you taking so that we're not bringing in disease from, high impact areas, which at that time were China and Iran. And they said nothing. And he said, well, what do you do when you see somebody who's visibly sick, coming off a plane at Schiphol? And they said nothing, right? That's prevention. We could have shut down airports in January. We didn't. And we can talk about the reasons why we didn't beforehand, instead decided to shut down the entire world while keeping airports open. So we tend to forget that all of these interventions have side effects, predicted as well as unpredictable, and that we have not really done a cost benefit analysis of our current interventions and treatment. So, we know about the mink culling, right? We've all heard in Denmark and other places, they've culled millions and millions of, which means to kill all these animals they had in factories. But should we even have mink farms to begin with? I'm interested in these questions, right? So they killed all these mink in Denmark, which are used for fur coats and stuff like that. That's they're bred specifically for that, because a mutated form of the coronavirus through the minks was found by the Danish government. And I'm saying that this is a very one-dimensional prevention, right? Kill all the minks and then grow a bunch of minks and make more mink coat and wait until the next swine flu or mad cow disease or mink coronavirus mutation happens. This is really stupid thinking. And as academics and scientists, we should be thinking beyond this to a meta perspective, right? And these include, looking at better labor force interventions, closing airports, having no exceptions for political or economic elites, working on better education, more education for lifestyle factors. So we know that overwork in multiple jobs have led to nursing home deaths. In Chen et al.'s paper in the National Bureau of Economic Research, they write, multivariate regressions comparing demographically and geographically similar nursing homes suggest that 49% of COVID cases among nursing home residents are attributable to staff movement between facilities. Again, completely preventable. All you have to do is pay people more and get more people working. But no, half of all COVID deaths in nursing homes could be attributable to a really stupid decision by people, greed, basically. The people who own these nursing homes, who are shuttling people between nursing homes, and they're bringing infection from different nursing homes. And it's becoming just, a soup of virus that could totally be prevented 100%. We also know that type 2 diabetes is a major comorbidity. So if we had done more education in the last 20 years, or starting now, today, about not eating too much sugary foods, not eating too much starchy foods, having soda taxes is a super easy intervention that already in Mexico has saved tens of thousands of lives. Is there a soda tax in Europe? Nope. But there should be, if we want to take the Nuffield public health intervention ladder seriously. We also know some of the side effects of quarantine, right? Loneliness, it's like smoking 15 cigarettes a day in terms of how bad it is for your health. And yet, we are doing all these measures, but not, taking into account the after effects, right? What, are we just going to clean them up afterwards? Is that our plan? Just like we were going to, find a way of using, the fallout from nuclear power plants, right? The idea is that the future generations in the 50s and 60s, they said the future generations will be so much smarter than us. They'll find a way to do it. So they're pushing all these problems towards the future. And loneliness is one of them, that right now, through our current public health interventions for COVID, they're iatrogenic interventions, which means the cure in many ways may be worse than the disease. And we need to take this seriously. Something we should also be talking about as part of our conversation, QALYs, quality adjusted life years. It's very hard to estimate these things, but we know that, for example, in terms of QALYs, more people are more people are dying in terms of years lost of life from malaria than from COVID. And yet there's trillions and trillions of dollars and euros going into COVID research, COVID prevention, and very little, less than male pattern balding, less money than is spent on us losing our hair goes into malaria research every year and intervention. So, I mean, it's sort of a joke if you look at how little we care. But is that because Europeans think we won't get malaria unless we go to a tropical country? Like, so why could that possibly be? And finally, with carbon and pollution, this is a tweet I saw at the beginning of the outbreak. And it said, I spread germs all around the town today, but I bought coronavirus offsets, so we're all good. So for carbon offsets, can I fly around the world? Can I consume lots of meat? Can I buy lots of tchotchkes and trinkets that I don't need and then throw them out and just say, oh, but I'm donating to, Greenpeace, so it's all good. Does it really work like that? Now, in this second and sort of final part of this, I want to talk about the fact that in infectious disease, COVID doesn't have lobbyists working for it. Mosquitoes bringing malaria don't have lobbyists, but the oil and gas industry, the pharmaceutical companies, the food industry, the chemical industry, all industries which I've worked on in the UCSF, University of California, San Francisco industry documents, which you can find at industrydocuments.ucsf.edu. So we need to look at why we haven't addressed the biggest drivers of disease and mortality. And well, we currently have worldwide $700 billion in direct subsidies for fossil fuel. And indirect subsidies amount to $5.2 trillion. That's 6.4% of global GDP, not for oil and gas, but for subsidizing the cheapness of them, right? Which we could get rid of tomorrow and the world would be a better place. This is Reagan explaining voodoo economics, right? And actually it was George Bush, who later became his vice president, who actually called Reagan during their election that he was using voodoo economics. So basically we have the wrong priorities, right? The costs of violence, of war, are far more than it would take to implement thoroughly the UN's Sustainable Development Goals, let alone to meet our investments to the Paris Climate Agreement. And in my work with the Union of Concerned Scientists, we've looked at how scientific research can show harm from products. It's how it can protect the public. The scientific community can speak out and decision makers can implement public safeguards. But then also how the industry can interfere. They can fake science, manufacture uncertainty, harness scientists to work for them and buy credibility and manipulate government officials. So that's why many in medicine are now talking about the commercial determinants of health, how commercial activity influences our health in a certain extent, almost more than any other factor. We know, for example, that we don't need cruises. We should just get rid of them off the face of the earth, and the world would be a better place. Carnival Corporation, which has 47 ships, pollutes more sulfur oxide than all the cars in Europe, 10 times more sulfur oxide than all the cars in Europe. And yet the first coronavirus outbreak happened on a Carnival cruise ship. And we know that industry knows that this is happening. Exxon in 1982 predicted better than any other climate scientists the amount of warming that their activity would cause. And they invested actually in ice-covered areas because they knew in 20, 40 years' time, they would be able to drill there when they couldn't because of all the ice. And so, our house is literally on fire 40 years ago. But these same corporations, they said once the effects of climate change are measurable, they might not be reversible, and little could be done to correct the situation in the short term. That's an Exxon report from 1982. And in 1978, a presentation for Exxon's corporate management said, man has a window of 5 to 10 years before the need for hard decisions regarding changes in energy strategies are critical. So basically, we know what to do, we just haven't done it. And inequality plays a huge role here. And this is, we know in the US, for example, that racial inequalities, economic inequalities are leading to more COVID deaths in those populations. Partially because of exposure, but partially because of less access to resources, to medical resources. And we know that we are all, because of comorbidities, and we're exposed to unequal environmental exposures, right? So the protective factors that we do have may be less effective in somebody who already has many exposures. So we have to face the music, I would say, that the richest, and this is just a fact, that the richest 1% of humanity are responsible for 100 times more carbon emissions than the poorest 50%. So inequality is part of the problem. Inequality is part of the problem with COVID, with carbon, with everything. And how do we avoid iatrogenic solutions? If we understand that industry and their pollution are disease vectors, and that inequality is a disease vector, as we've seen with Corona, we're only as healthy as our neighbor, then we have to concentrate on redistribution, right? So that the 1% are super spreaders of disease, including COVID-19 and climate change. And instead of creating these Spookvluchten, these ghost flights, right, to maintain our pathways for airlines, or now creating, if you want an end of times metaphor, because nobody's flying anymore, lots of airlines are creating flights to nowhere, where you take off, get infected by Corona by your fellow passengers, drink a few martinis, and land in the same airport just to keep their revenues going. And we need a better model, because that's just stupid. And we need to prevent that sort of stupidity from killing us. But we are, with energy, you could say we're flattening the curve. The price of oil recently went negative. And that it's even possible, due to the lockdowns in China, that over 70,000 lives were saved by the air pollution reductions that they achieved there. But is it enough? The 5% decrease in CO2 equivalent emissions in 2020 due to a really horrible event that is not a just transition, you could say. It's not managed decline, pales in comparison to what science tells us we need, which is an 18% reduction in carbon emissions per year. So we destroyed the lives of many and only got a 5% decrease because we're focusing on the wrong thing. We need to focus on the right stuff. So this is my final slide. And my hypothesis is that we care about ourselves and we care about death and we care about disease, but only in a very narrow sense. Terror management theory has shown us that our terrors are mismanaged, and that COVID-19 is a major public health threat, but has received disproportionate amount of attention because it does not discriminate according to human domination hierarchies. That is, that rich, poor, anybody could get it, even if I live on my little island. If I have a friend come and visit me on my billion-dollar island, it doesn't matter. That friend could still get me sick and I could die. So there's the equality question, and it's because of the sort of blindness of who can get affected. We've had Boris Johnson, Trump, many elected officials worldwide who have gotten COVID-19. That is why it's so scary to us, I think. Not because of the numbers, not because of anything else, not because it's particularly more painful than any other type of death. And I think we need to face the music on that one. So I'm saying that public health ought to concentrate less on COVID-19 measures and more on clean air, clean water, healthy diets, health education, and mental and emotional health. And that democratic societies should invest more political capital as well as other capital in preventative health measures, real preventative health measures, meta preventative health measures, and regulating these causes of, say, of pollution, rather than just looking at downstream effects. Thank you very much.
Thank you very much, Yogi Hale Hendlin, for sharing your thoughts and your insights on Corona and climate. I think a lot of things came across in a way touched upon. I'd like to share to the viewers at home that it will also be on YouTube afterwards. You can have a look and also see the presentation and the numbers. Looking at time, I would like to go immediately to the Capita Selecta Committee Board, and especially two students who prepared some great questions for you, Lorena Henner and Aniek Wiegand. I'd like to give the floor first to them, please.
Yes, thank you very much, Yogi. That was very interesting. We actually have a third committee member with us here as well. She had time to join, so she was like, oh, I'm gonna find them and join them in the room. This is Feng Li. We have kept up the Q&A chat, and there have been many interesting questions. So first of all, a few people actually were wondering, you were talking about how in the more polluted areas, there were more COVID cases, and people were wondering if they had taken into account that those areas are more populated a lot of the times.
Yes, so that's a common question that comes up. And of course, yes, they're often more populated, but even controlling for population, they found very clear evidence that the increased pollution, controlling for population, controlling for even class, other factors, that far more infections and far worse outcomes. So that was controlled for. But yes, obviously that's a consideration in any good research project.
Okay, thank you. I think that's clear.
Yeah, ik niet goed lezen goed hier. So there was one person who was wondering why we can't make the lobbying illegal, so that there will be less pollution because of that.
Could you be more specific? I see it but I'm not sure what it means. So why can't we make lobbying illegal, right? So this is a great question, and I think that lobbying should be, lobbying by private interests that have a financial gain, rather than lobbying for, say, a children's organization, or lobbying for, to create a local park here. There are different forms of lobbying, and unfortunately, it's sort of the worst forms that are the most prevalent. So when I think it's really important to distinguish between lobbying by organizations and people who do have no financial interest versus those that do. And I think, the question of why can't we act on all of these issues is the kernel question, which I'm trying to address here, because until we figure out a good way to make such lobbying illegal, and also to have what I call disruptive regulation, right? We've all heard of disruptive innovation, right? Like Uber and Airbnb. But disruptive regulation actually makes the playing field more fair for organizations that are trying to do the right thing socially, environmentally, and it would tip the scales in their favor. So then they could, take off with their entrepreneurship in making things better, rather than, being under the thumb of these big oligopolies.
Okay, thank you very much.
Yeah, so I had a question. Who should take the lead in shifting our priorities in these complex, interconnected problems?
Well, I think we all need to take the lead. I think too much of it is that we're always looking for somebody else to do the hard work, right? To do the heavy lifting. We know from Extinction Rebellion that when ordinary people protest, we know from Black Lives Matters that when ordinary people protest, including medical students, at UCSF, there's a large contingent, white coats for Black lives, right? I'm also part of the Do No Harm Coalition at UCSF, which also looks at, these sort of larger harms, taking the Hippocratic Oath, but looking at it on a societal, structural level. And so I think addressing structural issues and problems that our governments have been anemic to address, right? They've been impotent to actually follow through because they've been captured by corporation, and we have revolving doors between these polluting corporations and our government, let alone all the bribes and all that. But because they're not doing anything, we need to. But we know that we can be effective, right? Black Lives Matter has led to many police departments around the US sending in social workers rather than police officers to nonviolent situations now, right? So huge changes are underfoot. Extinction Rebellion has led to the British government, the UK Parliament, declaring a climate emergency. Now, what substance of that happens is different. But at the same time, the EU has dedicated €1 trillion in the next 10 years to a Green New Deal, which is just scratching the surface, but it's a start. So the point is that all of us can make a difference, but we need to organize with our peers and also across the aisle, across groups with people that we don't know, right? So you usually have people you get in a group and you make friends with people you don't know, and you work together, and then you can achieve something when you're dealing with structural problems.
Thank you. We were also kind of wondering what you think should be focused on. What should be the first step that we or the government should take? Because we were also in the news when you heard about the corona crisis, you read that the Dutch government has a lot of their shares in, for example, KLM, and that's why they got such a huge amount of money, and that's why we kind of cannot ban the airplane industry at the moment. But then what if the government would be willing to do something, or if we would do something, what should be the first step to do?
Well, one thing we can do is, and the Dutch government has some money in it, but it could nationalize it, right? If we nationalized oil and gas, as well as flights, it wouldn't be a problem anymore, because you wouldn't actually be losing so much money when you can't fly. You would just, pay people, some sort of wage to stay at home. Or even better, you say, okay, we have all these talented people sitting at home doing nothing. Why don't we put them on this other project, right? There's lots of really necessary things to be done that are safe, corona safe and all this. There are ways of dealing with it. But we have chosen the most greedy, where, if you look at stock prices, we have prioritized a complete engagement of the real economy, that of, you know, you, me, my neighbors who might have lost their job because their business closed during the lockdowns and the 2020 depression. But if you look at the financial economy, it's going through the roof. You know, housing prices in the Netherlands have not gone down. Speculation on stocks have not gone down. So we have a complete divorce from the real experience of millions and millions of people, billions of people worldwide, and the financial markets. So that's a big problem that also needs to be addressed in the same gesture as we address all these other problems.
Okay, thank you. That's very clear. We have another, it's more of a comment, I'd say, about the obesity and the corona. So they were saying that maybe more from a medical kind of view, that obesity can have many other reasons as well, such as hormones or just certain genes that are on or off that can also really depend whether a person maybe has a tendency to have more problems with metabolism and obesity. So they actually put some sources as well where they got their information from, and some other sources that said that obesity as such is not always correlated to more corona morbidity. So maybe you have more information about that as well, or? Sure.
No, I really appreciate that. And the last thing I'm trying to do here is, you know, fat shaming, as the commenter, doesn't accuse me of doing, but, talks about. I totally agree that there are many people who, for genetic reasons or otherwise, are larger than others. I don't think that's a problem, right? But we have to also be aware that most people who are obese are because of societal factors. Advertising, high sugar, fat, salt diets, lots of packaged and sort of extracted foods, pre-made foods. Let's also be honest about chemicals. A lot of these endocrine disruptors or anything that messes with your thyroid, right, can lead to obesity by no fault of your own, right? These are biochemical, industrial, environmental factors. So it's all connected, right? I don't think that, we should be, let me put it this way. In public health, we have a term called responsibilization, where we make, the victim of industrial diseases the responsible one, sort of the agent. They're the bad doer, right? That's the opposite of what I'm trying to do here, right? Because what I'm trying to do is put responsibility back where it's due, right? On our societies, our governments for not protecting us, on the corporations for exploiting and manipulating our natural human instincts, right? 10,000 years ago, if we could find fat, sugar, or salt, we would take in as much as we could, because it would be a very helpful thing for our bodies, because we wouldn't know the next time we would get it. But now we're inundated with it. We're also inundated with advertising. And we also don't have proper education. And we also are flooded with chemicals that have never before been in our environment, which are making all of our glands operate in very different ways than they did before.
Thank you. I was actually wondering one last thing as well. A couple years ago, we had another SARS virus, and I have to admit, I don't really know a lot about that virus at all. But how come that kind of stayed more, I mean, it did spread, but more locally than another SARS virus that's kind of similar? Like, did that much change in pollution or in how we travel? What's your hypothesis on that?
Well, first of all, these were contained geographically, right? And there was also less airborne spread. And so it's the airborne spread thing that was, if you read all these books from the last 20 years, that was like the scary thing. Now, fortunately, COVID-19 or is much less harmful in terms of the effects. It's sort of than many of these other SARS cases, right? More of these, if you got it any age, you had, say, a much higher chance of death. So we're lucky on that sense, but we're very unlucky that it's highly contagious, right? From air. So yeah, these are there's so many factors which go into infection rates, containment ability, and also morbidity and mortality. And so, I think that's why now we need to focus on air pollution, because what if the next COVID comes, but it kills 50% of anybody who gets it of all ages, right? Now, if we have the amount of air pollution that we currently have, the spread will be much easier to contain. And hopefully it won't go worldwide like it has now as a pandemic, but will stay as a localized epidemic.
Okay, thank you.
Thank you, Yogi, and thank you, Capita Select Committee, for those great questions. Unfortunately, due to the time limitations, we have to end this interesting meeting and the discussion. This brings us to the end of the lecture, but before we end, I would like to thank the Capita Select Committee, especially Lorena, Annick, and Ying Li. I'd like to thank Professor Klein Rensink, my colleague Lenja Slierendrecht, who was in charge of all the technical aspects of today. Thank you, viewers, participants of this lecture. As I said before, you can have a look after it on YouTube, because I think it was a very, very informative and dense lecture. And last but not least, Yogi Hale Hendlin, thank you very, very much for sharing your thoughts and putting those wicked crises or problems in a far bigger context. Thank you very much.
Thank you.
Thank you.